Welcome to the Holding Time podcast. Here we discuss breastfeeding in all its complexity, the ups and downs, the challenges, the triumphs. Whether you're expectant, a new mother, or simply interested, I hope you'll appreciate the incredible warrior women who are featured in this series.
I'm a doctor and I work in the Royal Hospital. General medicine and clinical pharmacology, drugs and poisons. Sometimes give advice about drugs in pregnancy, but very rarely, and that's it really, unless I see a pregnant woman on call in an emergency. So I wasn't prepared for the whole experience of birth and trying to get help with breastfeeding when breastfeeding wasn't working, and I'm now quite angry and appalled that women have to go through this kind of thing, and thinking about what I might try and do about it. The thing that I found most shocking was the inconsistency in different people's advice, the fact that advice available from an NHS provider was very difficult to come by. I ended up speaking to 2 lactation consultants privately, and also seeing another lactation consultant / midwife about tongue tie privately. So there's this kind of cottage industry of support of all of these very well-meaning women who've, dedicated their professional lives to it, but they're not paid for by the NHS. They're paid for in private practice, because the NHS isn't funding this area of need, and there's clearly a massive need. And because they are all in private practice, although they're regulated, they've got quite different approaches, and I had quite conflicting advice from different people. We had it, I think, fairly rough because I had an induced labour. I developed preeclampsia right on my due date, basically, and I had an epidural and lots of drugs. I couldn't hold him after he was born because I was too sort of whacked out, basically. So we didn't get our kind of skin to skin straight away. He was a bit dopey for the first 24 hours, 48 hours because of medications in labour. So we kind of started badly. We had a really unhappy experience on the postnatal ward with lots of people pressuring me to give him formula. So
Where did you give birth?
In the Liverpool Women's Hospital.
In the Liverpool Women's.
Which is where I sort of expected to have the kind of the Rolls Royce of care in the postnatal ward. And there were lots of very well-meaning staff, but they were desperately understaffed. They didn't have the support for me to be, for people to sit with me and help me for more than a few minutes at a time. And there wasn't, whenever I asked for help, it was a different person who had 2 to 5 minutes to give me. And a lot of pressure to get him feeding, and I kept being told, you can't go home until he's feeding, until you've got a consistent established feeding going on. We can't let you go home. And, he was kind of latching, but not really suckling. And then, not really latching that well. And the very first night, I gave birth at about 2 p.m. on a Saturday, and by about 9 o'clock that night, I was bounced into giving him some formula, which I was too tired and too confused and too anxious to argue against, really. I was kind of, you seem very anxious, I'm very anxious, let's give him formula. We had 2 weeks of me desperately trying to breastfeed him at home. They gave me a breast pump in hospital, and I used a breast pump for the first time in hospital, and that caused more nipple damage, which then led to a really resistant case of thrush that was really just desperately painful, and took a long time to work out what it was, because people kept saying, oh, well, that's just you've just got pain because you're starting off. And then so I had 2 weeks of just it, whenever I tried to feed him, it was just so painful. And then by the end of that 2 weeks, he lost about 7.5% of his birth weight, which my midwife was kind of she was like, no, she was actually good. She was really reassuring. She was like, you know what, I would have expected more, to be honest, and I think you're doing well. But I was just psychologically broken by the end of that 2 weeks. I was just, every time I fed him was just so painful. I just was crying every time I put him to my breast, and worried about the milk supply because he wasn't feeding that well. So I was getting up at all hours to pump and all of this stuff. She sort of saw me on the end of that 4 weeks of 2 weeks and just said, right, you need a break. You can't carry on because I'm worried about you, which was good. It was the right thing at that point. And so we started giving him a bottle. But I carried on pumping. So I had kind of a couple of days where I just pumped and he had a bottle, and then we kind of tried again. And we just went through these cycles of sort of doing this, getting a bit of more advice. I was kind of obsessively reading things on the internet and just felt like my every kind of waking moment was this sort of breastfeeding nightmare. And I think that I really just didn't and couldn't really bond with him at all. I felt really like it was a really strange kind of existential pain. Sorry.
I'm sorry. Your story is sadly familiar. I mean, just all too familiar. It takes a long time to get past this trauma, because it is trauma, really. Those 2 weeks are a dark place.
Yeah.
So just let me know if you want to stop, because I don't want this to be triggering for you. And also I'm aware that you might feel bad afterwards, and I don't want that.
I need to talk about it because I feel like it's such a strange thing that happened in my life experience. And some women you talk to and they'll kind of go, oh yes, like I know about this. And some women just like, well, why didn't you just give him a bottle? And
well, exactly, because that is the conclusion society draws. Yeah. And that's why we've got 99% of women formula feeding.
The sort of short version of the story is that I kind of there was just something in me that was so determined to breastfeed him. And, as I said, we got lots of different advice. So it felt like every week there was a different thing to try, and each thing that we were trying was really hard. Like we tried exclusive pumping, we tried a bit of mixed sort of pumping between feeds to try and build my supply. We tried lots of different nipple shields and all manner of different things that nothing really seemed to work to alleviate the pain of him latching, and tried lots of different ways to get him to latch well.
Was it coming from your lactation consultants that you were?
Yeah, so the big confusing thing was that the midwives were good. They came and visited, watched me feed, and whenever I fed in front of a midwife, they said, oh, that looks fine, everything looks perfect.
Was your baby able to elevate and extend his tongue?
Yes.
And so when he cried, did it turn?
Yeah.
So he had a posterior tongue tie then?
He did. And
that wasn't diagnosed?
It wasn't diagnosed. I was under the home birth team, and the midwife said she didn't think there was a tongue tie. They have a kind of an assistant in their team who has a lot of peer support experience with breastfeeding, and she did think that there was a tongue tie. Very confusingly, we went to a private practitioner who was also an NHS midwife who specialised in tongue tie. She didn't think there was one, and didn't want to snip it. And then when we finally saw the specialist nurse at Alderhay, she did think there was a small posterior tongue tie. So we went through this kind of weird yes it is, no it isn't.
The other sort of symptoms of posterior tongue tie are the nipple comes out of the mouth looking like a lipstick, slightly diagonal at the top. There's a clicking noise typically during feeding. And there's a pattern. And there's a pattern of mastitis that comes on like day 10. So, and obviously extreme pain for the mother. I know a lot about it because it's exactly what I had, and I went through a very similar journey to you. As a mother in your situation, exhausted, in agony, with a baby possibly losing weight, maybe with mastitis. You're still breastfeeding now, so
yeah. So
did you get it cut?
Yeah, so he finally had it done at about 8 weeks, I think. One of the things I do is I work in secondary research, meta-research, where you do systematic reviews of evidence and use those results to inform guidelines or health policy kind of stuff. I've done a bit of that in infectious diseases, in that kind of area mostly. But I was expecting to be able to find reliable evidence summaries about lots of these things. And they're just a desert where breastfeeding is concerned. I found a few good papers about nipple pain and breast pain in breastfeeding and how to go about sort of sorting out what's causing it, and but they're not really based on a lot of research. They're based on kind of clinical anecdote and you know, while I'm sure that there are lots of midwives and maybe even some GPs out there who have very good experience and know a lot from seeing a lot of patients, you know, there's a bit of a gap in kind of just, well, let's just do a cohort study and find out what's going on for women. And you just sort of think, how can this be that there's this huge, huge area of, I was having these bizarre conversations with my GP. So I kind of self-diagnosed vasospasm as one of the things that was causing severe pain when the thrush was kind of more under control, because my nipples would just go completely white and be extremely I'd have to sort of sometimes just go to bed with a hot water bottle after breastfeeding and just sort of curl up in a ball because it felt like my whole breast was kind of in spasm. I read up about, you know, how I might treat that, and well, first of all to find out what it was and then to treat it, and then had a series of conversations with my GP where she was firstly ignorant of that there was such a thing, and then she couldn't believe that I had it because I don't have Raynaud's, which is often associated with it. And then when she finally accepted that I probably did have it, she didn't know anything about its treatment. And I said, you know, there's a medicine called nifedipine, which is quite a commonly used blood pressure medication. And she was really worried about giving me the dose range that I'd seen recommended for the treatment of this. So she wouldn't prescribe me the right dose for it. So we had this long negotiation about treating the vasospasm. And then sort of towards the end of these consultations, she said, you know, we should get you in when you've finished your mat leave. We'll get you in and you can teach us all about these things. And I was sort of thinking, I'm the patient in this scenario. You know, I've had to go away and do all of this work to find out what's wrong with me.
Thanks for listening, and thanks to everyone involved, our funders, Cheshire and Merseyside Women's Health and Maternity Programme, Arts Council England Lottery Awards for their support, along with all the amazing mothers and partners who have helped to make this project happen. You can find out more about the project by visiting holdingtime.org.